Continuing our series on coronary artery disease. Yesterday, I had explained that what coronary artery disease is. As I had said that there are two coronary arteries, left and right. They supply blood to the heart. If they get blocked partially, it may lead to angina. If they get blocked fully, it may lead to myocardial infarction. If myocardial infarction occurs, the or a heart attack, if it occurs, the cells of a particular part of the heart go dead. As a result, the heart is not able to pump, and patient lands up into heart failure. There were risk factors, some which are modifiable, some which are non-modifiable. We had discussed this in detail. Today we are going to discuss about symptoms and diagnosis of coronary artery disease. Of course, the first major symptoms is chest pain which leads to angina. Chest pain may be central. Person may just tell about chest pain beneath the sternum, or may describe it as a chest pressure or heaviness in the chest. Patient may become short of breath, start sweating, may have palpitation, and or becomes fatigue. Palpitations means the heart rate increases. Type of angina, or a typical, rather let me not say type of angina. Typical angina, there is a central discomfort which is triggered by exertion, and it is relieved by rest. It lasts for few minutes. So angina basically lasts for a few minutes. While the heart attack or myocardial infarction, the chest pain is greater than 20 minutes. It may radiate to the arm, back, or neck. It can radiate to the arm, back, or neck. Patient will be short of breath, may have sweating, nausea. The inferior wall of the heart that rests on the diaphragm. So if a heart attack occurs, it would irritate the diaphragm, and that could lead to nausea and vomiting. Sometimes if this occurs in a young person, it is pretty difficult to diagnose it. If the heart muscle has been damaged to a great extent, blood pressure will fall, leading to hypotension. Diagnosis, simple test, ECG. ECG is available in doctor's office. You go there, you get the ECG. From the ECG, he can tell you whether patient is having a heart attack or not, or patient just has a supply which is less, angina. Person can also tell if he had a previous heart attack. Other test, pretty reliable, is the troponin I. It is a blood test. There are cards available, or there are laboratories which can do that test very fast for you and tell you whether person has a heart attack or not. Echocardiogram also helps. It tells us about the pumping of the heart. It tells us about the different valves of the heart. It tells about basically the structure of the heart. Tells us about the pumping. Pumping is usually between 40 to 70 to 80%. Then there is the stress test, where you run on a treadmill. Basically, the principle of a stress test is that when you run on the treadmill, the heart becomes very fast. So when the heart becomes fast, it requires more blood supply or more oxygen. Can the coronary artery supply this extra oxygen or not? That is the principle of a stress test. And finally, coronary angiogram. Coronary angiogram is the gold standard. You can exactly see see the arteries and find out how much the blockage is. There is also something which is known as CT angiogram. CT angiogram is done by a radiologist. You don't have to go to the hospital. That is a big advantage. You just get the angiogram done. If it is negative, you go home. Yes, it has one drawback that if it is positive, the radiologist cannot do much. He has to send him to a cardiologist, where he will put in the dye and look at the anatomy of the coronary artery disease. Key is don't ignore chest pain. Many times when a person has chest pain, they usually feel that the patient uh, has acidity or gas. They try and ignore it. If there's a typical chest pain, please consult your nearest doctor. Thank you very much.